Good evening. I decided this time around to record an audio recording of my lecture. A video would be too big. It's probably going to take some time to go through all the parts. It is roughly titled From Fear to Wisdom. We're going to discuss the Torah, medicine, and authority, and the trust. And this is all in the backdrop of COVID-19 investigations and examinations that are currently going through the news, through the Trump administration and the congressional hearings. It was started with Fauci's testimony and embarrassing taking fifth on the things that transpired and CDC's failures of the COVID time. It's been 6 years. I haven't spoken about this in any detail, and now I want to just cover and give some spiritual aspects, some historic references that happened in that time. We all went through it. We had the different reactions and different outcomes. And a lot of them were unfortunate outcomes. We lost people to that era, and a lot of young people succumbed to different conditions based on the false data and vaccinations that were presented as safe and effective were not as safe and effective as we now learn and understand. Now, one might say there's no proof and so on, but we have definitely a suspicion of wrongdoing because now all of this is becoming exposed, and through senatorial hearings, Senator Johnson, Senator Ron Paul, who are questioning the administration of the time, Biden's administration, even Trump administration, who started the entire thing, and the Fauci was active under both. But outcomes now are that populations are suffering with all types of ailments, and people are disconnected, isolated, and a lot of different effects of that are evident today as we have proliferation of some very rare and unwanted diseases, some turbo cancers, and other effects on the humans and the psyche. Children's psyche was affected because of the closure of the schools, and in general we are faced with some degree. A lot of people are faced with some degree of cognitive dissonance towards that era because people wanted to be safe and protected, and opposite happened. And I'll try to discuss this in part by part. I created like maybe 14 part, short segments where I'm going to discuss each aspect of COVID-19 era, and see if we can find some connections in Torah's wisdom and general, lessons learned, so to speak, takeaways from this era. So I'll start with the first point, which is the crisis of health that became the crisis of trust in institutions and governments. So so COVID-19 in general is not just a medical event or pandemic, as they say. It raised profound questions about trusting authority, your rights, your freedoms. It created uncertainty and questioned the individual responsibility. What were we supposed to do? What is the responsible thing to do? So we had questions about legitimacy of some public health warnings. There was considerable fear used to obtain compliance from population, and we had problem with trust in general. There's a pasuk in Mishlei. Shlomo Melech tells us, "Peti yamin l'chol davar, ve'arum yavin la'ashuro." Peti yamin l'chol davar means that a simple person believes every word, but a prudent person, he considers his steps. He's cautious. Now, this cautiousness has duality. What am I cautious about? If I'm trusting the authority, then I am cautious. It's prudent to do what authority says. But if I don't trust the authority, then opposite is true. I have to be cautious about the authority. Now, if you live in a dictatorial system, I lived in the Soviet Union, so nobody trusted authority. Everybody under wraps, they did what they thought was right, and they understood that authority is there to control, to drive a certain party line, and people did not agree with it. They did not speak out because of the fear of punishment, but they quietly did not agree, did not comply. But when you live in a democratic society, supposed democratic society where you have rights, then you tend to trust authority because there are supposedly elected representatives. We don't live in democracy. We live in representative republic, and we tend to believe when they tell us that storm is coming, when they tell us there's pandemic, when they tell us not to eat some foods because of the salmonella contamination. We tend to trust authority, and when that's not true, when we're misinformed about it, then the scale of damage that this can cause is in millions. And this probably what happened in this whole era. There was a lot of bureaucrats making decisions, not experts as we now know. Science was nowhere to be found, even though Fauci claimed that he's the science, and everybody has to listen. But it was far from truth, and therefore we all suffered as a result in different ways. In general, this was, because it had such a large scale, it was like yelling fire in the crowded theater, meaning when you have millions at your disposal, millions of people listening to your message, and then you come out and you say, put on the mask, take off the mask, do this, sneeze into your elbow, quarantine, stay at home. So people tend to listen, and what comes out is the residuals of these commands or edicts that will have different effects on different populations, on elderly, on children, and this is what we saw. It was total and complete abuse of these populations. They were thrust into environments that they were not used to. They were isolated. They were forced to restrict their breathing, to not have a proper nutrition, and in addition, the hospitals and other medical facilities who never faced this type of circumstances failed tremendously in the care of the patients, and the care that was not even delivered. Bedside manners were gone, and the situation rapidly evolved into a disaster that had very little to do with a so-called virus, but a lot to do with the social structures that were eroded very quickly and became a trap for a lot of people. Schools were shut down, and general fear set in. And the people basically split into these two major groups, those that followed and those that didn't follow. I like to think of myself that I did not follow in any way. I did not wear masks. I did not quarantine. We had minyanim going on. We defied pretty much all these edicts, even though the major institutions that we trusted, shuls and community leaders, they all fell in line, and most of them fell in line and pushed the party line and edicts, and closed down religious institutions, and prevented people from living a regular, normal life. Even the spiritual life was disrupted, even though probably the state had no constitutional rights of getting involved in what happens in the houses of worship and so on, which was unconstitutional, and only because of the leaders themselves who decided, whether it was Jewish leaders or Christian leaders or churches, synagogues, decided to close down. That's when the state was given their mandate, proper mandate through this leadership that was short-sighted to see what it could cause. So that's the idea. How do we know what is the proper guidance? Who do we trust? And that requires examination, investigation, and we're going to cover this in part 2. So next part is part 2. We'll talk about health as a obligation in the Torah. Rambam in Chochodeot, Perek Dalet, maintains that bodily health, health in general, spiritual health, is what's required for proper performance of the mitzvot and the study of the Torah. And a person who is sick and is not capable of doing basic physical activities, reasoning, thinking, movement, and so on, he is not healthy enough to perform mitzvot or study Torah. And therefore, he considers this as a requirement. And one has to make sure that he is healthy, and it's the obligation of the Torah itself, and God wants a person to be healthy. The other big topic in this is the pikuach nefesh. It's a genuine threat of life due to the circumstances, whatever is happening in society, whether it's perceived pandemic or war and so on, or dangerous situation in general, like it is in Israel and other parts of the world. So the threat to life, it cannot be simply dismissed. The Torah, therefore, does not support a reflexive rejection of, let's say, medicine or something in order to help in a certain emergency situations. But protecting life also requires evaluating the risks of treatment itself. So calculated risks has to be part of it. So the proper Torah question in cases of pandemic or COVID-19, it's not like many people pose it as a, are you a pro or anti-vax? They're walking around calling people like me anti-vax and using it as a derogatory term. But the question is, what are the benefits? What are the risks? What are alternative treatments? What are uncertainties, svekot, as we know, doubts, and what are the consequences for this or that particular treatment? What are the risks to different populations? This is what has to be considered. And we have a couple of Gemarot that discuss this in length. A Gemara in Yevamot that Kuf Yutet that talks about that we're not choshesh for the miut. So when something is happening in our environment and that presents a certain degree of danger, if it's minor, we're not choshesh for the miut. Now, this needs explanation. What does it mean? So you have two types of miut. Miut hamatzui, miut she'en hamatzui. That's Gemara in Chulin Daf Yud Aleph that talks about these concepts of a present and present danger, even though it's a minority of people are affected, versus non-present danger, meaning a minority people get affected by it, but it's not present for every person. The difference would be that it's very hard to formulate exact circumstances, but difference would be, let's say, if it's in case of war and cities being bombed, like in Israel, they're throwing rockets, and you don't know where they're going to fall. That's called miut hamatzui. Miut hamatzui, meaning it's even though a small portion of buildings are affected, but it could be your building next, so you have to go into bomb shelter. But miut she'en hamatzui is somebody catches cold. It doesn't mean I'm going to catch cold in the community. It's not going to be a general risk to go out and face people in a shul or in an office out of fear of being affected by something. So one has to take calculated risk, assess everything, and therefore the knowledge of the person who approaches this environment has to base themselves on educated decision making. What also comes into the play is the Chazakah, what is established as trustworthy or reliable course of action in each particular situation. So, broad Torah framework for the Chazakah is that we consider Chazakah less than the Rov, meaning the Rov takes over the Chazakah, and we do not consider Chazakah a decision maker for when the Rov is present. If most people do not get hurt by something, most people get in the cars and they drive, even though there is a possibility of accident, but most people take calculated risk and they get in the car, and if they follow all the rules and traffic rules and they put on a seatbelt, possibility of injury is minimal, and most people successfully do their chores and go around in cars. Even though because Rov dominates Chazakah, even though the Chazakah might suggest that under certain circumstances it's almost inevitable not to get hurt. For instance, if a person starts speeding above certain speed, then possibility of or ability to stop right away diminishes by each mile, and the person can get into serious trouble, because then Chazakah would be that under certain speed, if person can't brake on time, he can incur some damage and injury. So therefore, questions would be: what creates justified trust in, let's say, in government or in physicians or institutions? What creates trust in a policy? Is it a good policy, or it's just a general rule that does not apply to an individual? What happens when authorities, like now, acknowledge the errors that were committed? Are they now trusted? Is CDC now trusted, or is it just Fauci, or is it just a specific person? Once we remove that person, like a rotten apple from the mix, now we can trust CDC again, because RFK is Michah, and he's doing a better job, and he's eliminating all kinds of additives to foods, and there was tremendous reduction in vaccines recently from 72 to 11 doses, and that's not a small fit. So some people might consider that dangerous, but those who are on the other side and suffered for years from being pushed into the vaccinations might consider that to be a salvation, and actually a good thing, which I'm siding with. So also distinguishing earned trust from the blind trust. So blind trust, what happened during COVID, people blindly went into this crowd psychosis, and they saw virus everywhere, and they covered themselves with triple masks, and there are still people driving around in cars with masks, and it's very unfortunate. So the one has to know the difference between earned trust and blind trust. Earned trust is something that can be established, and then Chazakah comes back in saying that you can trust something. If manufacturer of let's say Ford or Chevy or CEO came out and he took the fifth, like Fauci did, when asked whether his cars were safe to drive, and he took the fifth, I don't think we would drive those cars. And when the major figure who was responsible for millions of people injecting themselves with the experimental substance that we don't even know what it is, and they suffered all kinds of side effects, he comes up and he doesn't want to talk about it and takes fifth. We all should be very, very worried about such medical devices, and do everything we can to abstain from in the future from things that produce very little trust. And so we'll consider this part 2. And now on to part 3. Part 3 will be science versus scientism. There's two main things that we're dealing with. One is science, what we consider a true science, where we investigate things properly through proper methods. And then the scientism is what we were presented during the COVID time and other times in history, where bureaucrats in general, politicians, they've pushed forward a certain action, and it has little to do with science and everything was to do with agendas, and under different rules and administrations, you could see this historically proliferating, where people were exposed to different vaccinations, like swine flu that claimed a lot of lives, and they stopped it as a result and canceled it. During the Reagan administration, immunity was given to vaccine manufacturers and pharmaceuticals that protected them from any harm, and now it's being fought in Congress, and soon it's going to be probably in courts, God willing, where these actions are exposed based on the previous mistakes the administrations made, trusting the wrong people to produce so-called solutions to health and protecting public health, which ended up backfiring and creating a lot of damage. There are many pharmaceutical drugs that were removed from the market. In fact, FDA, I think, removes thousands of drugs every year from circulation because of the ill effects that it has. A case in point was Vioxx, that caused like 50,000 people to die from heart complications until it was finally removed. And today the doctors don't prescribe Vioxx. But it took years and many lives to stop it. So that's what it can cost. So therefore, it's very important for good science to have good hypothesis, good testing, reproducibility of the studies is a prime in this list, and the studies have to be, we have to be able to falsify them. And if they're not falsifiable, they're not studies. They have to be open to scrutiny. Criticism in general, as a freedom of speech, we should be able to criticize anything and ask for evidence, for paperwork, so to speak, and then revisions and changes, if they need to be made, they have to be made in order for that science to stand on the solid ground. Scientific claims have to be in an open space. Corrections have to be made, and that actually presents a strength of the science and not its weakness, because the science is constantly evolving, and therefore it has to be always becoming better and not be claimed by some people. It becomes problematic when some people say, do not question the people who speak in the name of science, which Fauci many times did. He referred to himself as representing science, which is the height of ego, I would say, and that's evident also from his so-called diary that's being presented now, where he looked for the limelight all the time, and it was a popularity contest for him. So the Torah in general calls for intellectual criticism and machloket and questioning and demanding of evidence and rigorous argument. Throughout the Gemara and Talmud, we have that, and we do not let anybody just have a free pass because of his statute or position or influence on the Roman government or anything like that. And in the past, when such occurrences happened, let's say Machloket of Rabban Gamliel and Rabbi Yehoshua, where Rabban Gamliel 3 times embarrassed Rabbi Yehoshua, he lost his position and he was demoted. And that's evidence of steadfastness of Chazal and understanding that there's a limit to how much authority can impose and to safeguard against it. We had many outliers during the COVID, too many to list. These are courageous people who went against the prescriptions of government, and they did what they morally and religiously felt that they needed to do. This included some religious leaders on all sides, Christian priests who didn't shut down the churches, the rabbis who started their own minyanim who did not close down the synagogues. I know many of them. Dr. Tzelem, who Zichronat Tzadik Livracha, who was a righteous doctor who saved many lives in the Orange County, in the Kriyat Yoel area in the Satmar. He was the doctor there, and he saved hundreds of lives by stopping people from going to hospitals, for instance, because they saw very, very quickly the row of people that went to the hospital. That's what the rov takes over the Chazakah. They started quickly seeing that they would not come out of hospitals. Now we know it was a terrible care, besides all the other procedures that were damaging to lungs, the intubations and other things. And they basically recommended to the local emergency services to bring oxygen tanks to people's homes. And I know individuals personally who survived during the COVID because of the heroic actions of Dr. Tzelem, who simply prescribed basic supplementation to prevent further development of fevers and the ailments and other things. And all his patients, Baruch Hashem, survived, but he unfortunately succumbed to his own disease, cancer that he had, and he is no longer with us, but what he did is absolutely to be admired. And many other people who, like him, who are courageous and who are able to make a difference. In part 4, I want to discuss the idea of fear, and as an instrument of leadership of government. So we have Rosh Hashanah and months of Elul approaching and Rosh Hashanah approaching, we have an apropos Gemara here for Rosh Hashanah Daf Yud Zayin. Amud Aleph talks about Kol Parnas Amatil Ema Yetera Latzibur Shelo L'Shem Shamayim. Any leader, Parnas simply here means leader. It could be a rabbi, it could be a president, could be anybody who's in a leadership position. Amatil Ema Yetera Latzibur puts excessive fear onto the public, scares them, threatens them, tells them things not gonna turn out well. This was the Biden administration threatening those who do not vaccinate that the time has come for them to do it. They asked them nicely, and now they're going to use perceivably some draconian actions to force and deprive people of livelihood, children deprived of schools, the place of worship that restricted their congregants from coming and worshiping by closing the shuls and synagogues, churches. These are all fear tactics that scare tactics that they use in order to control. This is simply tools of control. There's a explanation is very simple. Emay Tara means excessive fear. Not every danger should be ignored, obviously. There has to be a balance. So that's why the Gemara says that it's possible to alert people to certain danger, but it should be l'shem shamayim. So any emay yetera shelo l'shem shamayim, that's not for the purposes of benefit, of protection, is considered unacceptable, and therefore the grave consequences for anybody who does that. So there's a responsible thing to warn people of danger, and sometimes it could cross lines into manipulation and fear, which definitely happened. There was a lot of that, and both the top down, the government and CDC and many leaders in the community and the rabbis in the community, they posted videos. They said, you gotta go vaccinate, you can't do this, what are you, crazy? You have to understand it's dangerous. But they didn't know anything. They didn't the very least you could do is say nothing. And many people who were not scientists, they were not even the doctors who spoke up, they're not scientists. They didn't understand any of this. They didn't understand mechanics of how the vaccine worked, how the intubation worked. They didn't understand. They made full-page ads. I remember where doctors signed their name, like parroting some guy at the top. And I know the guys at the top who don't deserve any credit, and because they participated in actual harm and of certain people because they had a title of a doctor and the rabbi, and somehow they thought that they were empowered to create consensus and push people towards a cliff, so to speak, and people who miscarried, pregnant women who miscarried, the consequence of the vaccination. Today we know that's an mRNA technology that penetrates deeper than they originally thought. It doesn't stay in the arm; it goes to the placenta, and then women miscarried. And I know specific, doctor rabbis who recommended that, and I think they were even sued for that. But be it as it may, we have to be wary of leadership that tries to push a certain agenda. And the fact that some people are still wearing masks in public places is that fear that never left. And the children that were prevented from interacting with their friends, even though there was very minimal risk to children, are now also in some cases, some places are exposed to COVID-19 vaccinations, which are absolutely unnecessary for children. All right, so we'll move on to part 5. And we're going to talk about COVID-19 as a case study. So we had lockdowns, we had mask policies, vaccine recommendations, vaccine mandates. So employment consequences for people who didn't follow those restrictions. Restrictions on travel, public participation, we all suffered from that. Different treatments that were harmful or deadly, and bad communication through government agencies. So we need to see what has been established as an evidentiary, procedures that were implemented, and what remains as a legitimate probing for these investigations to bring out, whether through Congress or through courts, and to see where was the failures of government and what did it exactly cause. Although nobody was really brought to justice here, even Anthony Fauci is not going to be really facing any grave penalties. He gets to have government protection, and he doesn't have to answer any questions. And they're probing it now in the Congress whether it could be censured, but it's not a price to pay for such grave mistakes that took place. So we have great people who warned us about these failures of the government. Primary one, ironically, was Dr. Carrie Mullis, who died right before the pandemic, I think, in 2019. And then they basically launched the entire thing with the PCR test. The PCR test were Dr. Carrie Mullis' invention. He got a Nobel Prize for it. He's the author. He's the expert. And yet, in many interviews, he said, particularly one on the Dr. Fauci, who basically puts him apart in this interview in 1996. You can look it up on YouTube. He basically says that Fauci doesn't understand anything about microscopy. He doesn't know what's what. He's not a doctor. He's a bureaucrat. And he would tell him in his face. You can look it up. It's a very interesting interview. And people don't want to face that. And PCR test was never designed to detect any disease. It was designed to identify particles, meaning that through multiple takes, the particles would become more visible, and you could find pretty much anything in anything. That was the exact words, if I can quote it correctly. You can find anything in everything. It's like perfect test to find crumbs. And just because you found something, he claimed, it doesn't mean that that thing causes disease. Even if you claim that something is a virus, which, by the way, was never isolated, was never properly presented, it doesn't mean it's a genetic virus or mutation or anything like that. It simply says it's there. It doesn't mean it causes disease. You cannot prove that with electron microscopy, because, like I mentioned many times before, electron microscopy is not to be trusted for a process. It's only trusted to see what's there. It cannot see moving physiology of viruses or pathogens or anything like that. So everything is rests in probably a flawed science of genetics that is still not resolved. It's going to be probably the next leg of investigation in all areas of mRNA technology that's being implemented now by many pharmaceutical companies. It's all based on earlier Watson and Crick's assumptions on the DNA sequencing. And the whole idea that we have a double helix or whatever, it's really a conjecture, it's assertion. It's not a provable fact. Even double helix, a lot of people believe in double helix. You will not find a real photo of double helix. There's no such a thing. You only have a photo 51, which was taken by a Jewish woman, Rosalind Franklin, who, through X-ray diffraction, she saw a top-down version of what they later called a double helix. Linus Pauling thought it was triple helix, but they decided it's going to be double helix, and that's what they sold to the public. And now we're sitting in this mass of genetic manipulation of mRNA, which by itself, you don't have to be a scientist to understand how dangerous it could be to get involved and play God with genetics, try to restructure and splice the genes and reorder them into a different formulation, which the body probably doesn't take lightly. mRNA is the middle of the process of transcription, and when you get involved, it's like jumping into someone's chair when they're typing something and start typing your own thing, which can make mess of anything. Any protein structures that result from that transcription could be faulty, could be mutated, and can cause any number of side effects. And the so-called science, did not even consider that as a potential. So part 6 will do basic idea of making people in charge at the time accountable. Fauci, federal agencies that were very active at the time. Many, even in Congress and in the local governments, that pushed the agenda and affected different parts of the country differently. If you could travel by car, you could see absolutely different settings. If you went towards Boston and New England, people were crazy about masks, and if you walked down the street without the mask, the people would call police. And in other parts, almost nothing changed. Nobody said anything. And the South was a little bit more relaxed about these draconian rules. So now the question is, all the doctors at the panels in the White House that spoke about necessity of certain procedures in place and lockdowns. What was communicated? That's what's important. What was communicated time? What did these guidances change and how it affected communities? All the uncertainties and in communication, and what evidence do we have of the effects, of the subsequent effects of these things? So there are now Fauci emails or texts are coming out where he is referring to or speaking to Dr. Walensky, and she is basically questioning second shots that were brought in. After the first shot, there were second shots. They say that the Fauci himself was injured in some way after a second shot, and he was brought into Walter Reed Hospital for treatment. I'm not sure of this information. I just heard it, and it's possible that he had some effects from it. But to the public, he pushed for claim that it was safe and effective. But the texts to Dr. Walensky show that the second shot caused cytokine storm, which a lot of people took very hard, and I'm sure there were very grave consequences for some people. Second shot, I heard personally from other people that they said like a load of bricks hit them and they were out for a week. And I'm sure they had very unsettling set of thoughts going through their head of what exactly they injected themselves with. And we all saw publicly people fainting. They distributed the shots in the dryways, without any supervision. By rules, they were supposed to be supervised for at least 15-20 minutes. People collapsed. We saw that all over the world, in China and other parts where people collapsed. They never examined, they didn't do a general examination of patients to see what level their immune system is on, if they have some contributing conditions that might worsen the effects of the shot if they're not strong enough. And that's what happened with so many faintings. You can go today on YouTube and see videos of different even officials, country officials fainting in public. Now you could say, oh, there's no proof or whatever, but we didn't see that happening before. Soccer players dropping on the field, athletes dropping, developing myocarditis and other inflammations, all type of weird and before unseen conditions. So it's proper for Senator Ron Paul or Senator Thompson to question Fauci and his administration and other people, hopefully, that will need to be brought to justice, so to speak. There's a Jewish principle of sheker en lo raglayim. The lies don't have feet and they don't stand on the solid foundation, and eventually these people will be found out, and we will learn, hopefully, something from these lessons of history, not to repeat it, because that's all they're made for. Even this talk is not settled. We will see some development, and we hopefully will, as a community, will address it at the proper time to hold those in charge accountable. And in part 7, I want to discuss the recent development of Trump administration, recent vaccine policy changes. They went down from 72 doses of vaccines to 11 doses, and it's an executive order. It's interesting how long it's going to last, because there are obviously forces in the pharmaceutical space that are trying to probably obfuscate that at some point. But right now it seems that it's acknowledged that this many vaccines are not necessary compared to other countries and developed countries who do not administer close to this range. And they brought down to 11 core vaccines, and they split the MMR shot into 3 shots. And that's good news. Obviously, those who don't vaccinate, never vaccinated, they don't care for even 11 shots. You're talking about communities that never vaccinated, like Amish community. They never had COVID. Maybe one person died in the whole community, and nobody knows if it was from COVID, because everybody, again, government lied and the institutions lied about was person dying from COVID or with COVID, and it was falsified. Papers were falsified, death certificates were falsified, and now it's absolutely evident that was true. I love when these conspiracy theories come true, and now the RFK's CDC is making these drastic changes in order to prevent future damage. The entire vaccine schedule is under question because of the COVID shots, they originally tried to sell the mRNA technology as a vaccine. They changed the definition of what is vaccine, even though it's not similar to other vaccines. But now you see how God works in the mysterious ways and brought the entire thing under question because communities never vaccinated, like Amish, like I mentioned. They never had any problems. They don't have problems. They're not dying from pandemics. They don't have young children affected. They have natural occurrences of chickenpox and measles, which are not dangerous, not like they were sold in New York, and they stopped prevented students from attending schools, yeshivas, and so on, because they said, it's dangerous. And that's where it was a failure of the rabbinic side for not investigating truly what are the risks of this. And there are no risks. Children who are affected by chickenpox or measles, they usually, if they're healthy and the immune system is healthy, and we're not talking about immune compromised, then they should be able to weather that storm perfectly. And I'm not sure if the children are immune compromised, they would benefit from any vaccinations. There's no evidence that the vaccines add any health. They're supposed to be just protective against some future disease, but even in that case, many children acquire chickenpox. I know actual children who got chickenpox after vaccination of varicella, and that's no 100% protection from vaccines. So now that's being questioned. Children that get Hep B vaccine on the first day after being born, it's absolutely unnecessary. It's not a non-communicable disease. It's only goes through blood transfusions and sexual intercourse, and the baby at the day one doesn't have any of that, and therefore it's not necessary. It's been argued for a long time, and now finally it's off of the schedule. So these are good things coming down the pipeline, and also it improves, and we'll make this chapter 7, section 7, it improves the ideas of informed consent, which, by the way, were taken wholesale away from people, this rights to consent. COVID-19 presented the biggest, probably constitutional challenge to informed consent, because people did not know what it is. Even doctors didn't know what it is. How can you have somebody consent to something that you as a doctor don't understand fully how it works and what are the mechanics? It was just put out to the market, and people didn't know what the effects of it would be. And because it was a top-down compulsory the vaccination, a lot of doctors just went with the flow, and they did not provide a proper guidance to their patients. In normal circumstances, when drugs don't work, the doctor removes the drug immediately, stops it, reduces the dose, and so on, because they don't want to face consequences of being sued, the malpractice insurance going up. In this case, they were protected by government because they could never be sued, and they were working under the auspices of hospitals and the malpractice insurance of those big institutions, and therefore they didn't care, or didn't want to care, or didn't know, whatever what you want to call it, but people were given no informed consent or proper informed consent, so it resembled more of the Nazi Germany rather than the democratic country that's supposed to provide that. So informed consent is a cornerstone of our freedom. Knowledge of risks and benefits, knowledge of ingredients, and the freedom from improper coercion. When you threaten people's jobs, if they don't take the shot, that's a coercion. It's a violation of Nuremberg laws. Guess where that came from? That came from the same Nazi experiments on children and on people. Experimental viruses should not be established as treatment unless we know full scope of side effects, and the obligations of showing the evidence remains in the responsibility of institutions and government. And when people are prevented from seeing the full evidence, and just market is exposed to certain chemical or vaccine and so on, then it is absolutely a violation of human rights, and people can definitely opt out of any of these experimental shots and so on for themselves, for their children. And in the future, it has to be examined with absolute scrutiny when anything is delivered to the market, and particularly showing that there's no responsibility on the part of the institutions. Torah does not support any product, any service, anywhere where there's no accountability. The Beit Din has to be able to enforce or punish individuals or organizations that might harm the community. And when they have total immunity, that is not an acceptable way of introducing something to the general public. There's no such a thing in business. Very, very small evidence exists in courts where immunity is given for a greater good of exposing bigger crime. But when immunity is given to a food or drug manufacturer, that opens the floodgates of corruption and harm. So there was part 7. And now we have part 8 of informed consent. There was part 8. Part 9 is idea of Tzelem Elokim. Tzelem Elokim is the idea that the person is created in the image of God. When the person is exposed to something that lowers the person's dignity, similar to Nazi Germany, when certain populations, Jewish population, was designated as less human, and therefore certain procedures could be applied to them of reducing their population. Whether they considered castration, they considered all kind of chemical intervention, and that's where the Nuremberg laws actually originated. That is the basis of disrupting this idea, spiritual idea of Tzelem Elokim. You're not to get involved with God's creation unless the permission is given. Even when Torah says permission is given, it's being cautious about it. That pasuk, it talks about permission that was given on a very, very limited basis to a doctor to help heal the wound, but it's not a blanket permission for human beings to experiment on other human beings. And many historical evidence, much historical evidence is there to show that when this is not regulated in any way, and we're not cautious about such procedures, then great disasters can happen and experiments are done on human beings. Part 10 is a medical and governmental humility that resulted from all this should be structured as follows. This is what we know currently. This is information we have. This is what we don't know. And this is present best judgment that we have about it. And it has to be done in an honest way, and with a certain degree of sincerity. And in order to establish that, probably it's good to look at the people who were operating at the time and are still operating in the government, who did not change their mind, just going with the wind, so to speak. And we have to be cautious about trusting the same individuals that propagated this pandemic and fear, and now are still sitting at the helm of the government. As far as I know, no specific apologies were issued by any of the people who are still here from those days, and that includes spiritual leaders who, in a way, followed those restrictions and in a way betrayed the community by not providing was the spiritual guidance that the people required who were in fear and suffering, and very little was done as a community, that we now have to, in retrospect, examine and see what can be a cure and recovery from these abuses. Number 11, we have a spiritual danger of fear that we discussed before. The fear normally narrows the judgment of a person, a community, and makes populations susceptible to all types of manipulations. When there's a vision or acceptance of certain genuine danger, or the denial of genuine danger on the flip side, it all presents a certain degree of panic and recklessness. So there's Chazal provide a formula where the yira of fear has to be joined with chokhmah. Yes, there could be dangers, and we have to be alert for any potential threat, but at the same time, we have to examine it with a critical eye, with chokhmah. We have to approach it. We have to ask questions. We have to say what, how, who says, why do I have to take this? Show me the evidence. Talk to me. And every doctor who prescribes something, a person sitting in that office has to be questioning it. Unfortunately, many in the Jewish community, they fall the victim to this authority, top-down kind of. They're convinced that doctors are there for your good, and there are many doctors are very, very much good people who mean well. They unfortunately operate in limited situations of the licensure and whatever the hospitals or their procedures provide. They try to do good, but they're not able to because their hands are tied in many circumstances. But one thing they can do is to be honest with their patients and to tell them what's exactly in the inserts of every drug, vaccine, and tell them about side effects that might be facing, and show them numbers, and not just to convince them and to be a propaganda arm of the government or the pharmaceutical company to administer these harmful drugs for which there's no recourse legally or in the healthcare setting. So the frightened, in general, the frightened population, the population that suffers or is in pain, they surrender judgment, and cynical population, which make fun of the other part of the population, can truly become spokespeople for the authority, ridiculing anybody who does not fall in line. So both I consider failures in both regards. So we need a more balanced and educated approach to everything. Part 12, we'll do spiritual lessons that we can draw from this. Refinement in the times of crisis. So weaknesses can be exposed in government, in medicine, scientific institutions, in media, in religious institutions, in religious leadership, in our own particular families, our own reasoning for why things are done a certain way. We need to explain it to our children and teach them the right way, not the wrong way. So better science is absolutely paramount here. Better medicine is absolutely needs to emerge as a result. That includes supplementations and vitamins and other things that were ignored by medical community because the doctors are not educated in nutrition, and then they didn't really understand how to heal the body with its own resources without drugs. Better informed consent, like we said, and better scientific leadership that can provide the mechanism and for accountability for anything that comes out of research and development. And that would create a much better grounds for informed citizens that makes decisions based on logic and intelligence and not fear. Number 13 is not succumbing neither to blind trust nor blind distrust. Both are the opposite ends of the bell curve. We need to stay somewhere in the middle where you can examine things. You look at Rov, look at Chazakah, look at what works, what doesn't work. And if somebody tells you there's a danger, even though you see no danger, they have to explain themselves. One who asks something of his friend, he has to bring the evidence why this friend has to do anything about it. Why do I have to get up and do? There is a idea of shav al taseh adif, meaning that doing nothing sometimes is better than doing something. So when you're in a predicament where you don't know what exactly is the next step, it's better to stay put and examine all the evidence before making the next step, because sometimes we come to the split in the road, and depending on which side you take, that could be too late for some people. I know people who wanted to preserve their jobs, and they took a shot, and they were nurses and first responders, so to speak, and they got unfortunately a neurological damage, and they lost their job and they lost their health at the same time. They suffered. They went through crisis, and this is not one person. This is thousands of people, I'm sure, around the world that experience the same thing, and that is because better science is not available. So we may never know why young people or children suffered or died in this period, and from previously unknown elements, the heart conditions by young 12-year-olds that became evident after the vaccinations. All types of turbo cancers and metabolic diseases that are also emerging. So that's very concerning. And therefore we have to, next time around, anybody claims anything, we have to examine it with certain scrutiny. At the end of the day, God is the ultimate protector, and those who do want to follow in the true and authentic laws of Torah, they will acquire a certain blessing and protection. Shomer Pitim Hashem is another rule where simpleton can be protected if he doesn't know better. There's only so much that we can find out through the resources that we have, the internet, and everybody says something else. So I encourage, just like I do, encourage you to study your own physiology, your own health, your particular type of environment that you're in order for you to facilitate and not to run out of the resources too soon, and the onset of any social unrest or crisis. So number 14, I'll conclude with that. It's a pasuk in Michah. In the Perek Vav, Asot Mishpat, Hashem is asking for only a few things. Asot Mishpat, ve'avat chesed, ve'atznei lechet im Elokecha, to do justice, which hopefully will be done, to love kindness, which we're bringing back love and kindness, and to walk humbly with God, not to assume too much that you're like God, that you can create things that God did not put in this world, to bring back the idea of body healing itself and God providing what it needs in order to heal itself. We're surrounded by refuah before the Makkah, meaning that God provides healing and cure before He brings any calamity to us, and we're able to protect ourselves. That's God's informed consent, that God's saying to us, don't worry, if you choose right, if you do be a steadfast follower of me, then I will provide you what you need. That's the true informed consent, and I hope that we all learn these lessons of now history and pass it on to the next generation so they don't repeat the same mistakes. Have a great night and Chodesh Tov and the month of Tshuva, month of Elul. We should all be zocheh to the Tshuva and see redemption in our days. Thank you.